In this video, I want to talk about some of the complications of an arterial switch operation. To review, an arterial switch operation is the surgical correction for transposition of the great arteries. In this congenital heart defect, the major arteries, your aorta, as well as the pulmonary artery, are switched. The aorta, which delivers blood to all your major organs, comes off of the right side of the heart instead of the left. Meanwhile, the pulmonary artery, which delivers blood to your lungs, comes off of the left side of the heart instead of the right. The arterial switch operation, all it does is it actually switches them back to their normal spots. It's an amazing operation that takes what was once a fatal condition and allows patients to live normal lives. However, there are some complications that can develop. Number one is coronary stenosis. Part of the surgery is you have to suture back the coronary arteries, suture them back on the left side. The coronary arteries are the blood vessels that supply blood to the heart muscle itself. And particularly, you can have narrowing in the very proximal portion right where they come off. If it's severe enough, that can jeopardize the blood supply to the heart muscle, and that can lead to deterioration in heart function. Number two is neo-aortic root dilation. The root here of the aorta, a lot of that is actually pulmonic or lung artery tissue. And it can get very dilated over time. In a normal heart, we worry about aortic root dilation because sometimes that can rupture and that can be dangerous. However, in this particular type of tissue, the natural history and the risk of rupture is not very well defined. In general, it's much less likely to rupture, and so we tolerate much higher, dilation than we would otherwise. Number three is aortic regurgitation. As this root dilates, it can stretch the valve to here. And so, the job of the valve is that it should stay shut, allowing blood to flow forward without going backward. But if the root gets very dilated, it gets stretched and there's blood that gets leaky backward into the heart, and that could lead to left-sided heart dilation. If it gets severe enough, and if you start having kind of some physiological sequelae, there's some evidence that the heart is under strain, you might have to do a valve replacement or the root replacement, and that's a surgical procedure. And then number four is branch pulmonary artery stenosis. We talked about how in an arterial switch, we're essentially switching the arteries back to their normal spots. But to do that, you have to cut them in certain areas, you have to mobilize them, and you have to suture them back together. And that could lead to stretching and kinking in certain spots. And you can get narrowing at these branch pulmonary arteries. In severe cases, you might have to have a catheter procedure to go in and dilate them with a balloon or a stent. Overall, the arterial switch operation took what was once a fatal childhood condition and has allowed people to live completely normal lives. While some complications may develop, overall the complication rate is relatively low. But it is still very important to follow up with an ACHD provider so that we can screen for these and we can diagnose them early. The earlier anything is diagnosed, the better, because we can do more about it.